This presentation will introduce you to some of the major categories of the autonomic nervous system drugs. I will also give you a few examples of each drug at each category. Sympathomimetic drugs are those that mimic the sympathetic stimulation. Their actions vary depending on which adrenergic receptors they stimulate. Catecholamines are closely related compounds. None of them are orally active because the stomach acid breaks them down. Dopamine is used for critically ill patients in shock to raise blood pressure, and since the kidneys have dopamine receptors, it also increases renal blood flow. One of epinephrine or adrenaline's main uses is to treat severe allergic reactions called anaphylaxis. The swelling in the throat and lungs compromises breathing. Adrenaline, which is available in EpiPen, is a sub-Q injection that causes bronchodilation. The indirect or mixed sympathomimetic agents increase adrenergic stimulation differently. They can increase the amount of neurotransmitter in the synapse by two different mechanisms, either by increasing norepinephrine or dopamine release from the nerve terminal into the synapses, or by decreasing reuptake of the neurotransmitters back into the nerve terminal. Ephedrine increases norepinephrine release from the nerve terminal and can also act as an agonist by itself. It is used to treat asthma or hypotension during surgery. Amphetamine increases norepinephrine and dopamine release from nerve terminals in the brain and decreases their reuptake into the nerve terminal. Methylphenidate or Ritalin just decreases reuptake of neurotransmitters. Amphetamine and Ritalin are used as CNS stimulants to treat narcolepsy, which is falling asleep unexpectedly, and occasionally as appetite suppressants, and for ADHD in children. Pseudoephedrine doesn't cross the blood-brain barrier as well, so it doesn't have as much CNS stimulation activity. Its main use is as a nasal decongestant. Alpha-1 agonists constrict blood vessels, so when they're applied directly to nasal passages like oxymetazoline, which is Afrin, or phenylephrine, they relieve nasal congestion without increasing systemic blood pressure. The beta-1 agonist dobutamine, when given IV, is used to increase the heart's force of contraction in congestive heart failure. Beta-2 agonists work mainly in the lungs to dilate the bronchioles in the treatment of asthma and COPD. Beta-2 stimulation of receptors in the pregnant uterus cause smooth muscle relaxation, which can be used in the short term to stop premature labor. Terbutaline is used this way. The Latin derivation of sympatholytic means to break or destroy the sympathetic nervous system. These agents, which block the action of norepinephrine, are also called adrenergic antagonists. They can be further subdivided into alpha and beta antagonists. Alpha-1 antagonists, like prazosin, treats hypertension. A similar agent, terazosin, is mainly used to treat benign prostatic hypertrophy, in which the patient has difficulty urinating. Blocking alpha-1 receptors in the smooth muscle of the bladder and the blood vessels makes it easier to pee. Pheochromocytoma is a rare tumor of the adrenal glands causing massive release of norepinephrine, causing dangerous spikes in blood pressure. Phenoxybenzamine is used to treat it until the tumor can be removed. Beta blockers can be nonspecific, meaning they block both beta-1 and beta-2 receptors, or they can be cardiospecific and block only beta-1 receptors. The nonspecific beta blockers include propranolol, nadolol, pindolol, and timolol. That's just a few. So if these agents are given to a patient that has COPD or asthma, they could cause constriction of the bronchioles and an asthma or COPD exacerbation. This is why the cardioselective beta-1 blockers were developed. Metoprolol, atenolol, and acebutolol are cardioselective and can be used in patients that have lung problems. All beta blockers end in OL-OL. Parasympathomimetics mimic the effects of acetylcholine stimulation. They are also called cholinergic agonists. Bethanechol exerts cholinergic action on the bladder, which relaxes the sphincter and allows urination to occur in patients that have urinary retention. Carbachol and pilocarpine are cholinergic eye drops used locally in the eye. Cholinergic stimulation of the ciliary muscles of the eye causes the lens to bulge, which allows aqueous humor to drain more efficiently in patients with open-angle glaucoma. Sjögren's syndrome is an autoimmune disease characterized by very, very dry eyes and mouth. Cevimeline stimulates secretion by the salivary glands and relieves this somewhat. The side effects of cholinergic agents can be remembered by the mnemonic called SLUG. Actually, you usually see this mostly with toxicity. And that stands for salivation, lacrimation, urination, and defecation. This will come up as we study some of these agents that can cause this. Acetylcholine is metabolized and eliminated by acetylcholinesterase, or for short, cholinesterase. So cholinesterase inhibitors increase acetylcholine, thereby mimicking cholinergic stimulation. So these drugs are indirect acting cholinergic agents. Centrally acting cholinesterase inhibitors are used to treat Alzheimer's disease. Physostigmine is used as an antidote for anticholinergic toxicity. Myasthenia gravis is an autoimmune disease where antibodies block, alter, or destroy receptors for acetylcholine at the neuromuscular junction, which prevents muscle contraction from occurring. Symptoms of myasthenia gravis include muscle weakness that improves after rest. Muscles commonly affected are those of the face, leading to a characteristic facial expression. It creates a sleepy, sad, expressionless face. Neostigmine, a short-acting cholinesterase inhibitor, which increases the amount of acetylcholine at the synapse, is used to diagnose this disease. After an IV dose, muscle contraction quickly normalizes. Pyridostigmine, a long-acting agent, is then used to treat myasthenia gravis. Open-angle glaucoma can also be treated with cholinesterase inhibitors such as ecothiopate and demarcarium, which indirectly increase acetylcholine. Contraction of the ciliary muscles of the eye allows aqueous humor to drain. This is not on the table, but I wanted to mention organophosphates, which are extremely potent cholinesterase inhibitors, considered poisons. They're found in some pesticides or nerve gases. That's when SLUD is the worst. Anticholinergic drugs block the action of acetylcholine. They block the rest and digest functions, so indirectly have the effect of adrenergic stimulation. Atropine is the prototype anticholinergic drug. In emergency situations in which the heart is beating too slowly, or bradycardia, atropine is given IV to increase the heart rate. Prior to surgery, atropine can be given to decrease mouth and lung secretions. Scopolamine, another anticholinergic, is available as a patch for motion sickness, calming the stomach and the vestibular system of the inner ear, which helps with balance. Since cholinergic stimulation causes miosis, or pupil constriction, the anticholinergic drug homatropine blocks this and the pupil dilates as needed during an eye exam. Belladonna, a natural alkaloid anticholinergic found in many plants, means beautiful lady because of the seductive appearance of dilated eyes. Drugs that cross the blood-brain barrier into the brain will have CNS side effects like drowsiness. Dicyclamine, which does not cross the blood-brain barrier, decreases bowel hypermotility and is used in irritable bowel syndrome. Oxybutynin relieves bladder spasms that cause urinary leakage and incontinence. Trihexyphenidyl, or Artane, is used to treat extrapyramidal symptoms, which are caused by excess acetylcholine, and that's caused by some of the antipsychotic drugs. It can also be used to treat some of the symptoms of Parkinson's disease. Glycopyrrolate is used pre-op to decrease salivary and bronchial secretions, making intubation easier. Anticholinergic side effects are caused by many drugs, and they can range from mild to moderate to severe, depending on the drug and the patient's age and tolerance. But they are easy to remember with this simple mnemonic: dry as a bone, blind as a bat, mad as a hatter, red as a beet, hot as Hades, can't pee, can't poop. So dry as a bone is referring to dry eyes and dry mouth. Sometimes blurred vision with the dilated pupils. Red as a beet refers to flushing. Hot as Hades refers to fever and hypothermia. Urinary retention and constipation are the other effects. Jimson weed is a plant that contains high amounts of atropine and scopolamine. A few years ago, some kids started smoking it to get high. It causes hallucinations and bizarre behavior. That's the mad as a hatter. It also causes severe pupil dilation and painful photophobia. In toxic doses, it causes hyperthermia and tachycardia and can be fatal. In fact, several kids did die. It took a while to figure out what was going on, but it finally went out of fashion. The antidote? Physostigmine IV, the cholinesterase inhibitor, which will have the effect of increasing acetylcholine.